Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, we're still in our LDA mode, folks. We've made Friday. It is a get 'em up out of town version, but with a theme that I believe is bringing a new treatment to you here in Western Pennsylvania that, just has some promising possibilities that I keep revealing to you each and every week. You know, that first week, back on November 2nd, we had the godfather, the guy who invented the whole doggone treatment called LDA. Of course, that stands for low-dose antigen. And we heard from him about how he came to this discovery and how well it's worked in his hands for a number of years. It, of course, has accrued multiple disciples over these many years. And last week, we had Dr. John Wyckoff as a guest of ours. He's a physician who treats up in East Lansing, Michigan, and talked about LDA in the treatment of autoimmune disorders. Now, today, folks, you're really going to enjoy our guest. She is a naturopathic physician, hails from the state of Washington. It's awful early out there, but she's consented to allow us to interrupt her morning to talk about all things gastrointestinal. Now, it's a real find because not only has she treated gastrointestinal disease, a real avocation of hers via naturopathic approaches, which is non-drug related, as you would well know. Now she's added LDA, and she's treating things heretofore never responsive in the past. You've got to hear about it. I think it's going to evolve into such a large group of shows that we're going to call this Part 1, and yes, she has consented to come back again. So I'm going to be very proud to present her today, Dr. Kathkeen Jenael, LDA, and the treatment of GI disorders, and I mean everything from mouth all the way to anus, whatever zip code and whatever goes on there, has a food connection, and this LDA approach seems to be making the turn for some very serious diseases. In the course of our discussion with Dr. Jenael, you want to call in to ask a question or to make a comment. That number, of course, will be 412-825-6262. That's 412-825-6262. And I'll give that number additionally throughout the hour. Now, here's the way the rest of the month goes. On Monday, and boy, am I looking forward to it. I just finished the book last night that he was nice enough to send to me. The book he tomed, first one, I think. I can't remember reading any credits about other books he's written. But he's written so much because he's an investigative reporter for the Tribune Review. Luis Fabregas has exposed many a medical ill in our region and shown the light and brightness on those ills to inform you, the consumer, to make you aware of things that heretofore you were unaware of. Well, that same thing happens now with his book entitled A Transplant for Katie, a description of a young girl, Katie Miller, from very near University of Indiana, IUP, University of Pennsylvania, Indiana. Creekside was the town. This lovely girl needed a transplant. She sure got it, and she got a host of problems associated with it, ultimately succumbing to this disease. A parallel track here, the saga of one young woman's endurement of this process, and a parallel track talking about the ills of the transplant program up there on the hill at University of Pittsburgh Medical Center. And I think some very revealing things will come out. Now that I've read the entire book, I won't give it away. I'll make you stay tuned for Monday to discuss a transplant for Katie with Mr. Luis Fabregas. On Wednesday, Deborah Lynn Dodge is going to be here. She's called the Queen of Green. So we're going to be talking about toxic-free living. And, of course, Alan Greenberg going to be our guest, finally getting him here. The Maryland doctor utilizing some proprietary approaches to detoxification of heavy metals. He's been on our show before. He's a great guest. We do have some already slotted guests for the month of December. Of course, we do have Susan Smith-Jones. First Wednesday, she's usually here with us. She'll be with us on that day. And she's going to be talking about how to get through the holidays without weight gain. So ladies in particular, you want to pay attention to this one. On the 3rd of December, the Monday just preceding her, Dr. Shetty, Ashok Shetty, he's an anti-aging specialist right here in western Pennsylvania, in particular in the Monroeville area, but many propose that they are involved with anti-aging. He truly is. You'll see what I mean when you want to pay attention to his discussion on that topic on the 3rd. Then Dr. Vera Sherman going to be talking about weight loss program for the new and up-and-coming new year with those New Year's resolutions probably just being formulated at the time. So that is action-packed, folks. Hope you keep listening along with us. Of course, if you can't, you very well know that these shows are archived. About 10 minutes after we get off the air, we put the shows up on the website at DJCMD. That's Dennis J. Courtney, MD.com. And on the opening page, click on archives. There they'll be, folks. Every radio show I've done since the year 2006. We had all of them up there at one time. We had to take half of them down, and so now we've started with the 2006. Who knows what we'll make the change again. But they're all there. Go on to the list sometimes. Peruse through it. Look down through that list. You'll see some very interesting topics with some pretty expert guests who discuss them. I'm really proud of those shows. I'd love to be able to put them up for you and your use. We know Dave Fish uses them while he's out doing his work each and every day. LDA, folks, has finally arrived. We got our serum in just yesterday. Supposed to arrive on the 15th. It absolutely did. If those of you out there who continue to hear this LDA message would like to be a part of it and be involved, and I'll call you, with this batch, okay? Because when you get the antigens and the mixtures, they're only good for 30 days. So we have just started the clock yesterday. It is still plenty of time for you who might be considering this to meet with me so that we can discuss if it really would be the appropriate therapy for you, and then to do the prep. You'll keep hearing about the preparation. Extremely important if the effectiveness of this treatment is ever to be realized. How you prep for it, what you do leading up to and directly after that injection is just as important as the shot, intradermal as it may be, is itself. And this theme keeps coming across over and over and over again. Maybe Dr. Jenael will be discussing it today. And I think that's about all the preliminaries I want to take up any time for today. I am very anxious to get to this guest. GI disorders, how prevalent are they? And every single one of them seemingly without a fix. None of them get fixed. They just get glossed over with some symptomatic relief. How would you like to fix them? Hey, we're going to be talking about that today with Dr. Jenael. Be right back with Dr. Jenael in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Do you have a mother, sister, or a daughter I want to tell you about a new way to detect early signs of breast disease, thermography. It's non-invasive, there's no radiation, and it's painless. Thermal imaging offers a safe alternative for women and men in the earlier detection and monitoring of many diseases, namely breast disease. Other reasons to utilize thermography may be physical injuries and chiropractic issues. Your body may be sending you a message. Did you get the memo? Heat. Health-enhancing thermography can read it. Early detection saves lives. Call us at 855-254-HEAT, 855-254-HEAT, or visit us at heat-images.com, heat-images.com.
Hey, good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday morning version of our show, and as you know, they've turned to be atypical. Normally we have just strictly call-ins, but in this month of November, we've focused on a therapy, a treatment that is very unique, practiced only by very few, with some pretty amazing results. Of course, you know that it's LDA, initially having the godfather himself, Dr. Butch Schrader, with us on November 2nd. Then John Wyckoff last week talking about autoimmune disease. Today, you're going to be graced with the lovely presence of a lady who's extremely knowledgeable in the treatment of GI disorders. Now, she herself is a graduate of Bastyr, a very famous naturopathic school in the state of Washington. She served some time, though, working with Dr. Mary Bove, a naturopathic physician in New England for about 6 years, returned back to Washington, particularly the Seattle area, and there she has practiced her gastrointestinal. She has a passion for GI diseases. We'll find out why, maybe, but has noticed LDA to be a great addition to her armamentarium. I present her to you now. She's bright-eyed and bushy-tailed, if you can believe it, folks. We want to thank her husband for putting her in that shape. Good morning, Kathleen. Welcome aboard.
Good morning, Dr. Courtney.
Thank you so much for, and I do mean this, for allowing me to invade your privacy this morning. But there's just so much to talk about. We met at a conference in St. Petersburg a few weeks ago, and it was obvious to me that your message was so powerful, I just couldn't let you leave the conference without asking you to grace your presence with us on a Friday morning, and here we are today. Your background, and I'd like to get into that a bit. We have a different concept of naturopathy, I feel, in the state of Pennsylvania, very far away from you. I'd like you to talk a bit about how you became involved and how you entered the profession of naturopathy, why so, and of course, maybe you can point out the difference to our listeners, because it's a different ballgame in the naturopathic world in the state of Washington, almost to the exclusion of all others. Can you take that for a moment?
Most certainly. When I was, preparing for medical school myself, I was definitely very scientific. And my undergraduate degree is in biochemistry, and at the time I'd heard whispers about naturopathy and thought it sounded a little bit far out to me. It wasn't something that really appealed to me. I thought it sounded a little bit even hocus-pocusy. So I wasn't inclined to go in that direction at all. Interestingly enough, I was planning on going to the University of Toronto for my medical training, had been accepted there, and was even preparing to go at the time when I found myself getting very sick. And with my symptoms, personally, I wasn't able to eat. Even drinking water caused pain. I was losing weight. I had severe abdominal pain, and there was no solution in the conventional medical world. I'd been to gastroenterologists, I'd been to regular doctors, and I wasn't getting any solutions. I wasn't getting any better. ago, I actually did turn to a naturopathic physician when someone had recommended that to me, and it was the first time I'd had relief from these symptoms in months. And so I got interested.
Yeah, that would certainly catch your interest, wouldn't it? It sort of changed your whole world around with an approach that finally, I mean, it is so embarrassing sometimes in the conventional medical world that I represent, the shortcomings of it, which is taken a turn for many a doctor across this country to move away from the use of those medications. As you moved into naturopathy, I guess having a set of GI symptoms yourself, is this, because it happens so often in medicine where personal tragedy intervenes, and whether it's a family member or sometimes the individual themselves, that's where they turn to focus their interest. Would it be a natural understanding and appreciation of your own case? Is that why GI became so intriguing to you? Because you pretty much concentrate on the treatment of GI disorders. Am I right about that?
Actually, I practice more family medicine. I'd say that about 60 to 70% of my practice is GI, but I do see people for family medicine and other issues.
Okay, and so you, when you spent some, I guess, learning time in New England, where is naturopathy as well embraced in New England as in the state of Washington, or not? Is it?
I would say it's more in an infant stage. I mean, the doctors who are naturopaths who have moved to Vermont have made great progress. They're probably about 10 years behind Washington State in terms of what they're doing. But there's some really great naturopathic physicians working in the state of Vermont, and we did have licensure, meaning that we could practice with a license within the state, and that's not true for every state. And so that was helpful. They're getting there.
Yeah, well, I think in Pennsylvania, I don't think we have licensure here yet.
I don't believe you do.
I don't believe we do. And in your state, just to put the final touches on that part of the conversation, you really got licensure. You're on staff of hospitals. In fact, I think every hospital must have naturopathic representation. Am I right about that, or am I a little carried away?
I think that many do. I don't know if all of them do.
Mm-hmm. So at least in up where the Bastyr is this very famous naturopathic school. It is located in the state of Washington, isn't it?
In Seattle, yes.
Yeah. Okay. So maybe is an understanding for why you're so progressive and advanced in this, because you have, if not, well, you obviously went to the #1 school in naturopathy, right? So there are some other well-recognized schools, but very few across the country, and and other states also too. I find, like Arizona has a very famous school, and they have the scope of practice, typically almost parallel to the medical world anyway. Medical doctors, MDs. So the NDs and MDs practice very similarly in these advanced states. And I just want our listeners to get an appreciation for it, because I think, although they may admire naturopathic approaches, they don't get the respect around here they really deserve. And I wanted to bring that very sore point to the forefront before we started. Now, okay, so you move into the world of naturopathy, move away from allopathic medicine, and concentrate on these GI disorders. I am really interested to start our conversation with something I think my listeners would love to learn about, and that is the naturopathic approach to many of these GI disorders. And maybe a very sensible way to look at this, Kathleen, would be moving from north to south, if you know what I mean, starting at the mouth, and there's plenty of zip codes on this 40 to 50-foot trek. Every single GI disorder that I can think of has a symptomatic drug approach that can be used to maybe get some symptom relief, but seemingly nothing happens with a C word, or at least a correction word. You found that to be true in the allopathic treatment of your own disorders. How do things move in naturopathy? How do you, talking about, esophageal problems, stomach problems, and the like, talk to us a bit about how you approach them. Is that a fair question?
Absolutely. And in fact, that's one of the reasons, not only because of my own experience of symptomatic relief but also because as I started looking around, I realized there wasn't a lot of successful.
Oh, you know, you're talking to your the mic part of your phone because you're fading in and out. I think you're turning away.
Sure.
Oh, there you are, right there. Wherever your head's tilted, keep it there. Go ahead.
All right, I got a brand new phone.
All right, good.
So what I was finding was that there really wasn't a lot of symptomatic relief in the conventional medical community.
You couldn't even get symptom relief with the conventional treatments, huh?
Well, it's really true. So there's a lot of suppressive treatments, but nothing that really even moves towards a cure. And what I'm finding is that, or what I initially was finding, was that a lot of the treatments that were being used, for example, the use of the reflux drugs, were really causing more long-term problems in the long run for people.
What would be some representatives of those drugs? Is that the Zantac realm, the Prilosec realm? What realm are we talking about here?
Really all of them.
All the above, huh?
Really all of them. And the reason for that is because the very first phase of digestion begins in the stomach, where the cells in the stomach are releasing hydrochloric acid. Now that's going to initiate the whole beginning of digestion, and that acidity is also incredibly important for absorbing nutrients like B12, for absorbing all of your minerals. So you're talking about enzyme function, you're talking about osteoporosis and bone density. So if that acidity is being blocked, and it's being blocked in some people as a treatment for literally years, then there's going to be a long-term consequence on the body.
Yeah, I think what you're trying to point to is so much of the treatment in the stomach region is antacid. It's to prevent acid formation, and as you're, I think, pointing to a moment ago, that acid release is extremely important, or you don't digest. Fair enough said?
Correct. You don't digest, and you can't absorb
minerals. Okay.
Correct. Mainly minerals and B12 are the two that I focus on, because that's where I'm seeing the long-term consequences.
Okay, so in the naturopathic world, how do you approach this? Many would say, at least I think Enlightened would say, you don't have enough acid, and there we are trying to stamp out the acid. How do you promote the initial stages of digestion with stomach disorders heretofore that don't even give you relief, maybe with the conventional drugs?
I have two approaches. My initial approach is to actually add that acidity in using something called betaine, which is the chemical form essentially of the acid that's released in the stomach. I'll give my patients a clinical trial of this. In 95% of the cases, that is the cure.
Wow.
That was the problem.
95%?
95%.
And so you're actually giving a betaine hydrochloride is the name of the substance, folks. Is that pineapple derived? Am I right about this?
No, that's an enzyme.
Okay, that's the enzyme.
Mm-hmm.
Okay, I don't know where are they getting the betaine from? Do we know?
The betaine actually comes from beet extract.
Beet extract.
Mm-hmm.
Okay, and you say 95% of the time, by bringing on the acidity, you're able. Are you using the C word when you say that does it? Is that what you mean?
Well, I feel like I have to go back in there and clean out some of the mess and the reasons why this started in the first place for a lot of people, and the sequelae that might have affected other systems in the body, like the immune system and the adrenal glands, that kind of thing. But, yeah, that's the beginning of symptomatic relief for 95% of people, and I can tell you why. The reason is that...
talking to that receiver again, we're losing it. Oh, there you are.
The reason is that the ability of the stomach to then empty into the small intestine is regulated by acidity. So you can see if the acidity is too low, that system isn't going to move downwards. Instead, it's going to move upwards. So all we're doing really by increasing the acidity for patients is allowing the downward movement of digestion.
Great way to sum that up. It makes so much sense. The stomach doesn't empty until certain pHs are reached, and they got to be low. The pH has to be low enough, meaning the acidity has to be high enough, or it doesn't get to the next step. Did I say that correctly?
That is absolutely correct. And let me talk about the other 5%.
Yeah, talk about that 5%.
So that 5% will have they'll have an exacerbation of their symptoms, of their reflux symptoms, when I give them that acidity, when I give them that betaine.
Mm-hmm.
And what that means is that there's enough erosion, there's enough a loss of that mucus protection layer within the gastrointestinal tract, specifically the stomach and the esophagus, that we need to take a step back. And sometimes for several months, we take a step back. I might keep them on their Prilosec, I might keep them on their acid blockers for that period of time while we're actually healing that system. And I do that by giving them something called emulsant formulas.
Called emulsion formulas?
No, demulsant. Demulsant formulas. It's a old word in the herbal compendium, which essentially increases the ability of that mucus layer to form.
Does that begin with a D? Is that demulsant?
Yeah.
Okay.
Demulsant.
I've seen the word now. I understand.
Mm-hmm.
Demulsant formulas. And that sounds like a generic term. What are some of the specific demulsants that may be used? Is that the right question? What are some of your demulsants?
It's herbs.
Herbs.
So I'm using things like licorice root, like ulmus root, which is slippery elm. These are pretty standard things that you can find even, in health food type stores, I guess. I'm not sure what you have out there.
Yeah, that sums it up. We have plenty of health food stores. Okay.
Yeah, okay. So you've got marshmallow root, you've got slippery elm, you've got licorice, and there's many others. And the thing about the principles of these herbs is that when you add water to them, they create this mucus, and that they create like a mucousy, gooey formula, which doesn't sound very nice, but when you give it in capsule form, it's pretty tolerable. So that's actually upregulating the body's ability to protect itself.
What a wonderful schematic there. 95% of the time you score just by creating the acidity, and if you need to have healing, you step back, you take some time, you say it may take months, using the demulcent approach, and then when you reach the point that I don't know what the clinical clue might be, but then you'll bring in the acidity once again, and you have really pretty much corrected the problem that has no correction in the conventional medical world.
Yeah.
Wonderful. I want to move further south. Do you mind?
No.
When we start moving beyond the duodenum, we get into a set of conditions that literally, when you see the word syndrome attached to a problem in the conventional medical world, you're pretty much saying, we give up, we don't know, we don't have a clue. That would be the very honest thing that they could say. But things like IBS, irritable bowel syndrome, where you have a collection of symptoms, two main diseases under that category. Could you take this category for a moment and talk about them? Because I got a feeling these are, if they don't score well up north in the stomach, as they move into these serious intestinal and colon disorders, they're not scoring well at all. I'm sure you have some very strong opinions about IBS, the conventional treatment of IBS, and the pitfalls of that treatment, and I'll let you expound on them for a moment. Why don't you take that?
Sure. There really aren't any. There really are not a lot of conventional treatments for IBS, aside from telling a patient to eat more fiber, which I find in a lot of cases actually makes them worse, especially the fiber is broken down into two types. There's soluble and insoluble. So the soluble makes that kind of gelatinous aspect to it when we ingest it, and the insoluble is like little brushes. It stays really dense within the system. That can be very irritating to somebody who already has irritation in their system. So from the conventional approach, and I've tried these things myself. I think I've tried everything on my patients, but they don't seem to do that much good. And those are basically your serotonin type drugs, or your drugs that are going to decrease a degree of spasticity within the system. Again, they palliate to some degree, but I've never really seen them do a lot of good, both with people who have come in with those drugs on board, and when I've tried them myself with my patients.
In the classic sense, things like Crohn's disease, which certainly occupy a large component of this IBS rubric, and colitis, probably the other component, these two are also dotted with the occasional and oftentimes life-sparing use of steroids. Could you talk a bit about that? Because, I mean, I pretty much in the LDA world, and I think you would agree with this, whenever you find that the use of steroids is the prime treatment used by the conventional world, especially for these GI disorders, more than likely the immune system has to be considered as a possible source to get the problem rectified. The use of these steroids is a main staple item in conventional treatment. How do you feel about that?
You know what? It's actually gotten worse than that. So there historically have been patients that have responded to the use of the steroids. There's now a body of patients that are not even responding to using those strong steroids to stop the symptoms. And historically, those people would be going into surgeries to have, bits of their system cut out, bits of their intestine cut out, year after year. That's really the only way to solve this problem. And for me, that's very motivating in terms of trying to find the cause of a solution, because I think that when the body is giving you symptoms like that and you just cut it out, you just remove it, you've never really solved the problem. Going back to the treatments that are now being used, a lot of the GI docs are recommending that people use tumor necrosis factor drugs. And what those drugs do is something similar to the steroids, but these are actually some of the original chemotherapy drugs. So they're blocking the immune system at an even deeper level. And if you look up some of these drugs, you'll see a black box warning that covers the entire page about them, because the side effects are so dangerous. And yet this is the current answer. I'm seeing a lot of patients come through my practice that are on these drugs and not taking steroids anymore, but on these drugs to replace the use of the steroids as a long-term solution to the problem. So essentially, again, suppressing the problem. And I just want to point out that I'm not opposed to suppressing a problem. I think that that's one of the places where conventional medicine excels. And sometimes it's absolutely necessary to do in emergency medicine.
Sometimes life-sparing,
Absolutely.
But for a short time.
For a short time. And then for chronic diseases, we've got to start looking for the answer. There's got to be an answer as to why this is happening.
I'm going to mention two drugs specific because I find, in fact, I have a family member that is so thankful that these substances are available to change their lives. One substance called Ascol, which I know you certainly, when people are on them, they get relief from them. I know you maintain. I'd let you talk about drugs such as that, and also Remicade. Okay, these are two common drugs used in IBS that afford some benefit. Talk to us about why they may be providing benefit, and how, in the scheme of things, they even may be necessary to continue for a while.
Yeah, my long-term goal is to get people off things like Remicade and Humira, which are the early anti-cancer drugs. Those are the tumor necrosis factor inhibitors. So those are the really, really strong ones. My long-term goal is to get people off those. If I can manage somebody using something like Asacol so that we've got their symptoms managed, and then I'm using the LDA to lower and lower that dose over time, that's really what I would consider one of the least invasive protocols. But I do like to use those drugs to manage symptoms. Either the patient will come in on those drugs, or we'll try some of them to see if we can manage symptoms while we're looking for the cause and treating the cause of their disease so they can actually get over their symptoms.
By the way, too, I'm just stunned to hear the cost of these things. I mean, when somebody talks about taking Remicade, this is like $15,000 a month to take this stuff. This is unbelievable in terms of who can even afford it. if you don't have insurance, you're not even going to be able to be placed on the drugs. And even at that, if you have insurances, the expense is still almost prohibitive.
Right, and I think the reason for that is because these were originally cancer drugs, so they have a higher price tag, and they're actually blocking cell division. They're blocking the cells from dividing.
So you say when it comes now to the intestinal disorders, you have a naturopathic approach to. Before LDA came along, we're going to get into that in a moment. How did you treat, and what kind of responses did you see for these very serious, potentially life-threatening diseases under naturopathic controls? How did they respond?
Well, dividing it up into the category of IBS versus inflammatory bowel disease, by the time that I had come across the LDA as a treatment approach, I feel like the IBS symptoms were fairly easy to get a person to be asymptomatic.
Easy, that is just fantastic to hear from somebody with your expertise. Easy. Please tell us how easy can be. How did you make it easy?
Really, when I saw a patient for the first time, they're going to have some of the symptoms of abdominal pain, bloating, constipation, diarrhea, reflux, any of those GI disorders in any kind of combination. And essentially, what I would do, and what I still do, because it works so well, is I would address their digestion from in the upper area. So we're talking about, we covered the acidity already within the stomach itself. I might add in some support for the gallbladder to digest fat. I might add in some support for the pancreas to release digestive enzymes. So getting that whole upper part of digestion going, and then making sure that we're dealing with the lower part. So if someone's having, and it's typical of IBS, of irritable bowel, people will have an alternating constipation, diarrhea, abdominal pain, alternating constipation, diarrhea. So they're in this cycle. So I just use the appropriate fibers and nutrients to get the lower part of the system working. I send them away, and send them away usually with some lab tests so that we can talk about some of the underlying causes specifically for them when we met again. And most people would come back saying they were at least 50%, if not more, better.
Wow. And some of those specific substances that you use so depending on what part of the cycle they're in, if they're in a hot cycle, they're having diarrhea, how would you approach that? And then if they get in the cool cycle where they're constipated, because there's this alternation, and then the abdominal pain, you got 3 cycles there. How do you intervene in both? I'm so greedy. I need to know, Doc. You got to tell me, because I got to know these things. Because sure enough, you're right about those 3 phases. How do you handle hot, cold, and oh my God, agony? I guess we'll put it that way.
Well, they kind of all go together, really.
Mm-hmm.
So here's what's really easy about it. I use the same thing. I use the same thing to treat all of those symptoms, right? And you know what? The abdominal pain is either coming from a cramping pain, so the body trying to move something out of the system really quickly, a cramping pain, and typically that's going to be either some kind of hidden infection or a reaction to food. So those are the things I'm actually testing for. So when I see the patient again, I can say, we need to work on this as the problem. Once they've gotten some symptomatic relief. The other source of the pain is going to be a bloating pain. That's almost always coming from infection, sometimes from an adverse reaction to food. But what I'm giving the patient initially to help with digestion is going to help with those 2 problems, the problem of the pain, whether it's uploading or cramping pain, they're going to get some relief. And then in terms of getting the lower part of the system going, you have to ramp up really slowly. And this is, I think, the problem with somebody here's an infomercial, or their friend tells them about something that works really well, and then they go out and take a bunch of it and get worse. So the thing that's really important about working with the regulation of the lower part of the system, the diarrhea, constipation, is to increase the doses very slowly.
Of what? What are you dosing them with?
I find I get the best results using a fiber called acacia.
Acacia.
hmm And I use that fiber with something called N-acetylglucosamine, which is going to increase, again, from a different mechanism of action, it's going to increase the mucus layer that lines the gastrointestinal tract. And that mucus layer is incredibly important because it's the first thing that breaks down when you start to look at the leakiness of the gut, the damage that happens to the permeability of the gut. That mucus layer contains all of the probiotics. It contains all of the end-stage digestive enzymes that help to digest and absorb nutrients into the system.
And you just said a magic word that I think everyone's antenna jumped up. You said probiotics. Utilizing them the entire course, do you wait until, do you do, because people would think, oh, I got to cleanse, okay? So do you cleanse and then lay down a new bit of bacterial flora in the form of probiotics? Or is that just so simplistic that shouldn't even be brought into the discussion at this point?
I absolutely do not do that until
Oh, I love this. Absolutely, yeah. She says. Why would you absolutely not do that? And I think our listeners would want to know, because they would look at this as like the primary way to deal with it.
It makes a lot of people feel worse. And what I want to do initially is get people symptomatic relief, and then go back and find out, is that an appropriate part of their treatment? If someone doesn't have enough of that mucus layer lining the GI tract, you can throw probiotics at it all you want. They're not going to do anything. They're not going to have a place to live, as it were. And oftentimes, they'll actually exacerbate symptoms. And I don't want to see someone for the first time and give them something that's going to make them feel worse. I want them to feel better, and then find out from lab testing whether or not that's an appropriate way to go with the probiotics. So I think when people go out and start taking the probiotics, they can actually make themselves feel worse, or that won't do anything for them whatsoever.
So this dual approach using fiber substance, like you said acacia, is that what you said?
I find acacia is the best fiber. It's a nice soluble fiber, and that works for that alternating constipation diarrhea symptom. And the caveat is you have to increase it very, very slowly.
And then the mucosal barrier restoration through the use of N-acetyl what?
N-acetylglucosamine.
Okay.
That's essentially one of the components that we're going to find in our cartilage. We're going to find in
people who have joint problems take glucosamine sulfate and chondroitin sulfate, right? I mean, these are common.
True.
We're trying to restore that barrier. This is just an offshoot of it, huh?
Yeah, exactly. They're related. Yeah.
Okay. Well, you're giving away all the pearls here, but I'm prying them out of you. I'm making you fess up, and you are absolutely fessing up. Now, the time is moving on, and this all comes to us now through Dr. Butch Schrader and his great work with developing a process called LDA, a procedure, a treatment. And I know you use that treatment, and I know you found it to be, that final touch to take people that just need to be completely rescued. You're able to take, in the cases you presented, by the way, these people were so afflicted, and maybe you should talk a bit about those severely afflicted ones, people bedridden, confined to the house for literally years sometimes. And I'd like you to talk a bit about that. And I know we got callers that want to get in there, but today we're going to spend a little bit of this build-up to how are you exposed to LDA as a possible therapy? How long ago was that? How successful were you in those early cases? How successful are you now? Take it away on your revelation exposure to LDA.
Sure. I was really looking for something to help the patients that I was not being able to alleviate symptoms with, and that was mainly the inflammatory bowel disease cases. So just to differentiate for your listeners, IBS, irritable bowel, yes, is problematic and hard to live with. On the other hand, inflammatory bowel disease is very serious, very life-threatening. And again, I think we talked a little bit about the strength of the treatment approaches and the side effects of those approaches already. So with people that have an inflammatory bowel disease, what that means is that there's actually ulcerations occurring along the digestive tract. So these people are going to have a lot of bleeding in their stools. They're going to have mucus in their stools. They're going to be in severe pain. They're not going to be alternating between constipation and diarrhea. They're going to have severe, uncontrollable diarrhea, which is why they're put on these really strong tumor necrosis factor drugs as a result, because you have to do something. People that are uncontrolled and unresponsive to steroids, for example, come into my office and they're literally emaciated. They can't keep any weight on their bodies. And so that's going to affect them in the long run. So I was looking for something for these people because I was happy with the results I was getting for the IBS symptom. I wasn't happy with the results I was getting for the inflammatory bowel syndrome.
Mm-hmm. Speaking of that, you were losing you again.
Sure.
There you go. There you are. Okay. I'm bringing you back. All right. So you were looking for something. How did you find it? Or did it find you? What?
You know, I read an article years ago. I've been doing this for about 20 years now. And I read the article. It was an article by Dr. Schrader in New Mexico. It sounded interesting. And because so much of my practice is about, discovering what kind of foods are causing these GI problems and then asking the person to stop these foods, what I was really looking for was a way for them to have more of a normal life in terms of their diet. Not to say, okay, this food is a problem, your body is attacking it, your body's reacting to it, so never eat it again, especially when we talked about, a group of 5 or 6 different foods. So I read this article and I thought it sounded interesting. And it sounded like a different approach. Well, the article kind of, fell into the pile on the side of the desk that we all have, that one.
Mm-hmm.
And it was down in there, and then years later,
it worked its way to the top of the top?
It worked its way to the top. I have no idea. This is a little bit of a divine intervention, I think, happening. But there it was, and it was just right at the time where I had a lot of these cases of, microscopic colitis, lymphocytic colitis, inflammatory bowel disease, and I was desperate to find a treatment for these people. And so I started reading about it, I started researching it, and that's how I got involved with the LDA treatment.
And how long ago was that it worked its way to the top of the pile?
That was about 3 years ago now.
3 years ago. Mm-hmm. And so getting that initial training and bringing the LDA treatment approach, I always let everyone who I speak on the issue of LDA define it in their own terms, because I'm sure as you explain this to the patients, you have your own way of telling them what the heck LDA is. So do it for me too. Do it for our listeners. What is LDA from your perspective? How do you explain it?
Essentially, LDA is providing tolerance where tolerance needs to be. So when you have these diseases, the body is intolerant to something. We don't know what. It could be a part of the body itself, like we talked about in terms of molecular mimicry. It could be something that you're taking in terms of food, or something that's living in there already, like a bacteria, but there's an intolerance to it. So what we're doing with the LDA is we're giving a teeny bit, not homeopathic, but a very dilute amount of the food, the bacteria, the inhalants, with an activator. And what that does is upregulate or increase the number of the T regulator cells. Those are the cells that are miscommunicating, that are telling the body to attack something that doesn't need to be attacked. And it decreases that response. And over time, we can actually retrain the system to a tolerance where it can tolerate its environment, where it can tolerate foods.
Now, there you go. I have asked many people to describe LDA to me. I got to tell you, that's the first time I've ever heard a description like that. That is just a wonderful way to explain it, completely different than I'm used to hearing. And it does, I can see where it really helps a layperson, a person who's not medically inclined, to move right along with you. Great explanation, Doc. Is that the kind of explanation you give your patients every time that you talk about this?
Pretty much. And that's what makes sense. I think that it makes a lot of sense to people. They know something's wrong. They know something's causing the problem.
All right. Now, with LDA, 3 years, it's not all that long. I mean, a 20-year career. By the way, you do not look like, I don't even want to ask ages, but okay, 20 years of working in this realm, and 3 years of it with LDA. As you move into the LDA arena, you happen to mention the word testing a lot. And I noticed when you presented cases there in St. Petersburg, you do quite a bit of testing. Could you explain to our listeners the need for testing?
Yeah, I think it's really important to establish, again, what foods or what chronic infections are underlying the problem. And the main thing I do is I'll do a food panel, a blood panel, where we'll test for two different antibodies, an IgG antibody, which is a delayed hypersensitivity antibody, and an IgA antibody, which is essentially an antibody that is secreted along the tube of the digestive tract. So we're testing for these things in the blood, which I think inherently makes sense to patients in terms of, if this is happening in the gastrointestinal tract and we're picking up the information in the blood, that means there is a degree of communication or even leakiness in the gut itself. So we test for those things so that I can say, hey, look, while we're getting your system under control using the LDA and some other things as well, we know for sure that these foods are a problem. So you need to stop eating these foods until we can develop that tolerance to the foods again through the LDA.
Yeah, I think you point out a really unique component of LDA. Most every other approach is a complete elimination of that food literally forever. I mean, you're just told, look, these foods you're very allergic to, and you must stay off of them forever, or you can expect a return of your symptoms and your disorder. In LDA, there's at least a promise out there that with this treatment, you may be able, more than likely, will be able to reintroduce those foods and not react to them. If I got that right, is that pretty much a big difference in the LDA world compared to all others?
That's the miracle of it.
That
yes,
is a miracle,
absolutely.
isn't it?
And I want to tag on that also with foods where people have an IgE reaction, which is the immediate hypersensitivity to foods, the one that is really considered the classical allergy. In conventional medicine, that's where you get, anaphylaxis and breathing difficulties, and it's life-threatening. The LDA actually works for those foods too.
Yeah, now that is interesting. We're told by the great guru himself, Dr. Butch Schrader, that one thing nice about LDA is that you don't have to test, that all the allergens are in there anyway. But I noticed you emphasized, and I've asked you to explain, and I think you have, why, and I think you said you always like to show a patient like on paper, to have like a paper trail for where they start with their reactivity, and then you're able to track that out, and clinically you see that really helping you with explanations to your patients. Did I get your message right?
Yeah, I think that's fair too. I think people want to know why. They want to know what's going on inside their body, why is it happening, and it really helps to have some actual scientific evidence to show people. Now, I got to back up a little bit and say that when we're talking to an allergist, a conventionally trained allergist, they're not looking at these same antibodies. So, and it's really not part even of their scope of practice. But when we were all trained in medical school, whether it was naturopathic or conventional, we all learned about the four main categories of allergies under the umbrella of allergies. And the different antibodies that were associated with it. So what I essentially see happening here is that a lot of people are coming to me saying, well, I've already been tested for these things, which is true. They've been tested for an immediate hypersensitivity and they're negative. What they haven't been tested for is a delayed hypersensitivity.
Amen to that. And it's revealing to find out that the allergy world, the allergists, the experts, only deal with the immediate. They never deal with the delayed. It blew my mind when I talked to a couple of allergists and they seemingly knew about delayed, but when I asked them, okay, that's a great description of your immediate hypersensitivity treatments, now what do you do for the delayed? And then they told me, oh, we don't do anything for the delayed. Wow.
Yeah. And I think that's because there's medicine that treats an immediate hypersensitivity, and it's immediate. That's where a lot of our conventional medicine is focused in immediate symptoms. It's the chronic stuff. It's the day after day exposures that cause problems that don't necessarily get the same kind of attention.
All right. Now look, with a couple minutes to go, as you could see what's happening here, get ready for this, Doctor, because I'm going to come at you here in a second. We've laid some groundwork I just think is so important, and I'm so thankful to hear from you your naturopathic approaches that did and have continued to work so well for you, and my listeners love getting that insight from you, and certainly will help them. But we're on the threshold of discussing LDA, and we haven't even talked about a case. So I think I did warn you. I forewarned you that, Dr. Jenael, there's so much information here. We're never going to be able to cover this in one show. And on the air, and I know I'm not going to embarrass you because I think I forewarned you, you got to come back, don't you?
I would love to.
I don't know. I mean, can we do this on the air like next Friday? Because we're doing LDAs on Friday. Can we get a commitment? Do you think you're at this hour in the morning? What else are you doing, Doc? And if you're doing something else, it's illegal. Okay.
Well, I think I'll be recovering from a lot of turkey next Friday.
Ah, okay. So do you want to make it another Friday, or is that next Friday okay for you? Whatever Friday you want.
You know what? If we could bump it up a week.
Okay, well, then let's do that. Instead of next Friday, let's do it the following Friday, which is going to be on November 30th. Perfect idea. We should all take a rest. I'll do a repeat show at that point, and we're going to bring it back. And on that day, now that we've laid this groundwork, I do want my listeners to hear some of the fascinating cases, severe cases where conventional medicine was either completely failing or it was flailing, and to hear you talk about these turnarounds, maybe in the remaining moments, these turnarounds are miraculous as far as I'm concerned, and it was LDA that allowed you to make the turn. Could you make a little discussion of that before we leave you today?
Do you want me to present a case?
No, don't do that much. Just talk about the miraculous turnarounds, because as I listened to your presentation to us, they were all miraculous. I know you hand-picked cases that would be that startling, but nonetheless, just completely changed the lives of people whose lives were ruined before they met you. How does LDA conquer that group of people?
Really unbelievable. I mean, in about 85% of the cases, unbelievable treatment. Not always immediate, but when it's immediate, it's amazing. So I can have someone going from not being able to leave the house because their symptoms are so bad, they're actually living in the bathroom and losing weight and just really, really sick, in a lot of pain. And after the shots, I've had actually recently a patient walk out after we did the shots and go to the front desk and say, "Did she just give me a painkiller? Did she just anesthetize me? Because it's gone."
Oh my
so that would be the extreme case of success right there.
Oh my goodness, that really does have a heck of an impact on any doctor to think something happened that quickly just after you gave the antibodies. How could you even justify? How can you even dendritic cells, evidently? You know, you and I would converse and say that. All right, we have laid that groundwork. We are coming to the end of the show, and it is the great jump-off point, because when we meet next in a couple of weeks, we're going to be talking about, I want my listeners to know, these night and day changes, this use of the C word. I mean, if you require treatment once every 2 years to maintain a symptom-free life, to me, that is a C word, okay? If you need an injection every couple of years to handle it. And here you are at the 3-year mark. I'd be interested to hear how your cases, the ones that initially responded, and how well they're doing, because they're in that phase right now where you've spread out their injections considerably, I'm going to guess, and maybe the C word is actually applicable to a number of them. I know the cases that you presented certainly appeared that way to me, and that's what we'll be discussing next time we're together. Fair enough?
Sounds good.
All right. Ladies and gentlemen, can't you tell? You're with a special lady this morning. Special skills, special expertise, naturopathically derived, started with their own issues and personal medical issues the conventional medical schools, medically trained people couldn't handle it all. Thank God she found that she shouldn't go in to conventional medicine and moved elsewhere, and we're the benefactor from that. So I want to say thank you, Dr. Jenael. We're now set for the 30th. I want to thank you, listeners, today. LDA continues. Part 2 of LDA and GI disorders will be on November 30th. We'll be back with her then. Until then, this is Dr. Dennis Courtney with Dr. Kathkeen Jenael saying so long for and impact on your health.